COVID-19 to monkeypox and now measles. 3 cases of measles have been detected in the province of Limpopo. The National Institute for Communicable Diseases says the outbreak can be traced back to the Sekhukhune district in Limpopo. Now, the province's health MEC is Dr Phophi Ramathuba, and she joins us virtually now for an update. MEC, thank you so much for your time this evening. People might listen to this news story and say 3 cases, surely that's not enough to cause panic. Explain to us why it is now being called an outbreak. Unfortunately, we can't hear you, MEC. If you could unmute yourself, please.
Sorry. Evening,
no problem.
And evening to your viewers out there, and thank you for giving us this opportunity. Yes, in terms of the case definition of an outbreak, once you have 2 or more cases in the current situation where we want to believe that we've already covered the population in terms of immunization and vaccination, it should be a worrying factor, and therefore it gets to be declared as an outbreak. And surveillance teams are always on the ground on a daily basis to pick up some of these cases which are suspect and alert to us. So yes, indeed, it might sound like 2 cases, but here we're not dealing with a novel virus. We're dealing with something that we had thought we have already eradicated.
What do we know about these 3 cases and the communities that they come from? What do we know about their rates of vaccinations, especially of our precious little ones?
I think we need to be honest here in terms of the vaccination rate in the Sekhukhune district. That is where we even raised the alarm previously, concerns about the rate wherein we are at around 66%, sometimes 71%, depending on month to month. But when you look at other districts like Mupani and Vembe, that's where you've got around 100% in some stage. When they've not done well, they would be at 95, 94%. So it has been a challenge in terms of vaccination. When you look at this, the cases now have been confirmed to be 4 after we did contact tracing. Yesterday, our team and even today had been to the villages to look into these cases. 3 of them were detected around the Beggarsford area. The one is from around the Groblersdal area. Now, when you look at these cases, none of them you can confirm if they have been vaccinated. They have not been vaccinated. The age gap, I think it's between 1 year and 11 years. So that is why now the campaign of getting all the children from 6 months to 11 years, 15 years, getting to be vaccinated. And this is the work that we've started with our social development for those children at the crèche, and also for children with the basic education at the primary schools, so that we cover them. With the particular cases that we are talking about, 3 of them that I'm indicating are from one area, Beggarsford. We have already dispatched the response team, the outbreak. What we could find is that we find they are residing in an area or in a house where it is a house of a traditional health practitioners, where we found more than, I think, around 60 people in that house. Already 13 had signs and symptoms of measles. We've already collected the specimens for that. The remaining 43 that were not symptomatic, we had already vaccinated. And this includes adults who were there for other treatment. There was a function apparently. So we are monitoring that situation very closely. We have already isolated those that were found to be symptomatic so that we can be able to curb the spread.
Speaking of curbing the spread, measles, as a reminder, is highly infectious, isn't it? Remind our viewers what they should be looking out for in terms of symptoms.
I think what is important is that they must look at if you have fever and the popular rash, the the rash that you would have all over the body. Once you have those two, plus either one of the three, which could be conjunctivitis, your eyes, redness, and always scratching them. Secondly, either you could be having running nose, or you could have cough. So if you have one of those three, including the fever plus the maculopapular rash, those would be real signs or symptoms that are confirmatory towards measles. We will have to collect the specimen and do a test in the laboratory. And in this case, NICD brought back the results and confirmed to us that indeed we have got confirmed cases of measles in our province.
Now, Dr. Ramathuba, long before we had these long debates about vaccinations that was brought on by COVID-19 and the need to have our adult and younger population vaccinated, I remember having discussions around how we as South Africans have taken for granted that we have such a strong vaccination tradition, if I could call it that from the ages. In fact, I was reminded when I had my baby just under 2 years ago, before the child is 3 days old, before you've left the hospital, if you've privileged enough to be able to do that, the child has had its first set of vaccinations. And it's only later on that you realize that is not necessarily the case all over the world. Do you think it's fair to say that sometimes we take that for granted and that there are perhaps little spots in the country, rural areas in the country where we have overlooked the need for an education drive or ongoing education and encouragement for our little ones to be vaccinated?
I think you're quite right. If you look at, like I've indicated, these cases that have been confirmed, none of these children were vaccinated or received any of the dosages of measles. So they've been able to miss, whether it's 6 months, whether it's 12 months, those children have not been vaccinated. And these children we found them around the villages, the rural areas. And what was quite concerning for me is that the team that has been in that household where we found a number of people, there are those that have refused to be vaccinated and also refused that their children being vaccinated. So this, hence you have seen, we're saying from Monday, we will be reporting in those particular areas so that from this, the level of a politician, we've already met with our local councillors. We've already discussed with our mayors to say this calls for political intervention and leadership so that we go around, we bring our churches together, bring the traditional health practitioners committee that we work with on a number of diseases, including the COVID vaccination. We've got to go back to how we managed to succeed in our COVID-19 vaccine when we had a lot of those myths and apathy. So with the measles, it has proven that the children that have been vaccinated do not get infected. Actually, they're safe. And we had thought by now, for instance, those areas that I've indicated, we've got 100% or 95% coverage. You will hardly get any measles case. So in this particular area, because we've not been doing well, because these are rural areas, probably more education. We need to work with our local media. We need to work with you in the mainstream media to bring more information and educate our people, because it's only information that will help them to own up to their health. And parents will now understand that the health of their children is their responsibility as parents, and make sure that every child cannot leave the hospital without being vaccinated. And when the nurses gives you a date that bring the child on this particular day for this particular vaccination or immunization, you'll make sure that the card is up to date. So we will also not focusing on that area only. We will be rolling out the catch-up plan, because we must also be alive to the reality that COVID-19 also on its own has made it possible that we regress in a number of areas in terms of other disease, because all the resources in the past 2.5 years were so focused on dealing with COVID. So some of the conditions got to be neglected, and some of the parents never took their children for the immunization. So the catch up, and if you remember, there was a time wherein we had shortages of vaccines for children as a result of the supply that we were supposed to get, some from overseas. These are national tenders that are also involved here. So that will give us an opportunity this time around to say, let's get a catch-up plan, let's get basic education to assist talking to learners themselves, to say, go and look in your card, ask your mother for that card if you did get this a vaccine. So children themselves, we know they're going to help us to make sure they are up to date in terms of the immunization.
Just one final question before I let you go. I know you spoke about your team isolating the cases that you know of in the areas that you know of in Limpopo. Can you confirm for us, or do you have any information about whether or not somebody from those areas have crossed borders into other provinces? That's the first part of the question. And the second part of the question is, I'm assuming you have been in contact with the National Health Department, and there'll be an alert of some kind for your colleagues in other provinces to be on alert, not just for cases, but also to start looking at the areas that perhaps have been underserviced in terms of vaccinations.
Yes, working with the NICD, we have made sure, because also the area of Sekhukhune, it's bordering with Mpumalanga province. While the current cases that we have seen, we do not have history of traveling to outside the province. We are alert, and you will never know whether the patients are telling you the truth, because as I've indicated, where we found these cases, it is a house, I would say it's a healing house, where there's a traditional healer who receive patients from all over the country. So some of them might be going back today and tomorrow to there, even though we have tried to say no one must leave until we have cleared all of you. Those who are symptomatics, we want to at least isolate you for 7 days. They will be sure that where you're going, you might not infect. But we have been in contact with our counterparts, our officials, especially focusing on our neighboring province, like Mpumalanga, to say we have these particular cases. But as we are doing a profiling of these cases and the contacts, we will be able to get more information where these patients are coming from, because some of them do not want to open up. But we know with time, let's develop trust. Once they trust us, they got confidence, they'll be able to tell us where they're coming from, who have they contacted. And then in that way, we will, as a country, be able to keep it. And I believe that South Africans are resilient, and I believe that our healthcare workers have managed to learn from the worst scenario, which was a novel virus, which is COVID-19. Dealing with measles is not something that would be too complicated. We know where the problem are. The problems are the apathy in terms of taking our children for vaccination, taking responsibility as individuals, as parents. So that is where the message must be on the community. We have said to all our primary health nurses, to the OPD nurses in the hospitals, let's stop staying in the hospital, because diseases are not in the hospital. When someone presents in the hospital, it's a sign that the system out there in the community is collapsing. So we're taking everyone out there. Let's do door-to-door, talk to the people, ask them what do they know about measles. Let's get the community radio station. Let's get Imbizo. Let's get the traditional leader there. Like in this village, we've already contacted the traditional leader. We want to go and address the community there about measles, the complications, the dangers. Because some people think, no, it's just rash. They forget that some of the children might end up with hearing loss. They might end up with eyesight challenges. Some might end up with pneumonia and even die of measles. And even the adults who thinks they are not infected, that we do have adults who have been infected. We have seen adults, especially those whose immune system is compromised. If you're diabetic, if you're hypertensive, if you've got cardiac problems, you get measles, you're gonna complicate pneumonia, and you might die because your immune system is weak. So people must not just think this is about fever and rash. We are worried about it can complicate. We've seen babies with diarrhea and vomiting ended up dehydrated, and they end up dying sometimes with kidney failure. So we want people to know, not scaring them, but we want them to understand how important is it for us to fight measles and to eradicate, so that people can know that every disease must be eradicated within the community, and every single condition must be elevated to the status of COVID-19. If we do that, we will be able to save lives.
Indeed, back to basics and follow the science. Thanks so much. Limpopo's Health MEC Dr Phophi Ramathuba joining us virtually there. They're dealing with a measles outbreak in Limpopo in certain parts, rural areas specifically. Some interesting insight there about what the health workers on the ground are dealing with.